or you're all very welcome. So just a little bit about Gigi and the Gigi Academy. So myself, I'm Lisa Hughes, and my co-founder Jenny. We're both nutritional therapists, and we launched Gigi back in November with our debut product, which is the PMS and hormone balance blend. But along with that, we really wanted to create a space that we could provide education on an abundance of different topics, all related to female health and well-being. And I suppose this one around future-proofing your fertility, how can we protect and support and restore it? It's all part and parcel for that. So we do have 3 other webinars that we have done, and we can share them with you all when we're sending the recording for this one. But they cover a really wide variety of topics, from female-focused nutrition to PCOS and menstrual health 101. So I'm going to introduce you to Dr. Codruta Pandalache, who we are so delighted to have joining us this evening. She is a specialist in restorative reproduction and women's health with over 15 years clinical experience. So thank you so much for joining us, Dr.
Very
Codruta.
welcome. And thank you for everyone who signed up and who's watching this, and for everyone who's going to rewatch it on YouTube and on Instagram. I really hope that you will find this helpful with whatever questions you might have, or whatever subject we'll cover. I barely made it at home, so
well, we are
sorry for the dogs. You know, I'm in the boys' room, so, but you know. Yeah, so over 15 years, about 17 years of clinical experience, different experience. I recently re-specialized in restorative reproduction and women's health. I did obstetrics and gynecology to start with, very, very beginning, and that was my dream. But because I became a mother and a very busy individual, I never really went back training for obstetrics in Ireland. Mixed background, general medicine, internal medicine, still doing still doing A&E, still covering nights in hospitals, and I did a second specialty, oncology. So
wow,
everything. Everything, and I think it's very important that I'm bringing all this luggage with me into the restorative fertility world, because it's not just one thing, it's the whole human. So that's me in a nutshell.
Incredible. And I suppose all of that experience and the time that you spent in so many different kind of sectors within the health space is what kind of really helps you now in the restorative reproduction and supporting women as well, because it's so multifaceted, women's health.
Oh yeah, and like, I know we're talking about women's health. Sorry, I know we're talking about women's health, but this is couples health really, and we always have a partner, or you know, there's always a man there somewhere in the picture when it comes to fertility anyway. And not only our clinic at Neo Fertility, I was trained in Neo Fertility. We offer women's health, but men's health checkups as well. So, you know, if your partners are there and, you know, they might have issues, or you think that they have because they don't think they have them, give us a shout. We're here to support both female and males.
Amazing. And that's something that we're actually going to touch on later on. So I just go through like a brief overview of tonight's webinar. So we're going to do a bit of a deep dive into what restorative reproductive medicine is, what it involves, maybe the difference between restorative reproductive medicine and more traditional forms of fertility treatment, understanding our menstrual cycle. It really is the number one thing when you are starting your fertility, if you're further along, having that really deep understanding of your individual menstrual cycle, what different tests to consider, when to consider them. We're going to look at AMH, preserving egg quality. We're going to learn a little bit more about male fertility, the role that it plays, how to support it, and then supporting fertility long-term through our nutrition and our lifestyle. And then, as Jenny mentioned, we're going to have a time for question and answers at the end. So please, if there is anything that has been something that you wanted to get a little bit more information on, or yeah, you're struggling to find answers, this is the opportunity. So, Dr. Codruta, can you please give us a little bit more information on what restorative reproduction medicine is?
So, how I always explain it to my patients, the couples who are coming in and trying to conceive, basically the definition, it's in the words, we are gonna restaurate your reproductive health. So if you have issues with your fertility, there's always a cause. So with restorative reproductive medicine, we are gonna dig deeper and find the root cause of your infertility, and once identified, we will address it properly. Restorative reproductive medicine uses medicine, as in tablets, and we can use surgeries, which is we can send you to either the obstetrician, gynecologist, to urologist if it's the guy's problem. So it's a combination between medicine and surgery, but the provider, the doctor, me in this case, will lead you and will tell you exactly where you have to go. We will refer you to whatever specialty we need to refer you, but the main definition is in the title. We are going to restore your reproductive system, your reproductive health, and your overall health. One big saying, and I think this sticks to everyone, a healthy woman is a fertile woman. If we're not healthy, we're not going to be able to procreate, to get pregnant, or we will have recurrent miscarriages. So keep in mind one thing, you're very healthy, you're going to be fertile. If you have health issues, underlying health issues, you are going to struggle. Restorative reproductive medicine is looking into the root cause, and very important, like you've mentioned, cycle charting. Half of restorative reproductive medicine is it's cycle charting. It's you knowing your body. You identifying every single phase of the cycle, knowing when you're ovulating, knowing what's happening in your cycle. And you guys have a lovely webinar, and I recommend everyone to go and have a look at that webinar. It's easy to understand, it's easy to digest, and yes, understanding your cycle is very important. And you have the slide there up. Every menstrual cycle is different. Unbelievable how many cycles I see in a day of work. Different lengths, different flows, different symptoms. It's very important to know yours. You do not read about other people's cycles. You do not compare, because every single person is different. Knowing when you are fertile will lead you into knowing when you can get a baby, when you can get pregnant. Many patients are not aware that they can only get pregnant about 7 days, 6 to 7 days in the month. It's important to know the fertile window, like you said, 6 days of your cycle, exactly, that you can get pregnant. It might be 7, it might be 5, okay? How do we know when we are ovulating? Very important things. There are 3 indexes that restorative fertility medicine uses. The cervical mucus, which is extremely reliable in 90% of the patients. The basal temperature, which is reliable if you know how to do it correctly, and if you know how to record it correctly. And the LH strips, which will basically test your urine for a surge in your LH. So what we are trying to do is to combine the 3 indexes in order for the patient to be able to identify when they're fertile. Sometimes it's working wonders. The 3 of them are aligned, you know exactly when they're peaking, when they're ovulating, but the majority of times they don't align. So we need at least 1 cycle charted in front of us to be able to identify possible problems and when you ovulate. We might not be able to do this from the first month of cycle charting. We will ask you to do another month. This is part of restorative fertility medicine, cycle charting. Again, tracking your cycle, very important. There are many apps out there. What we use is Chart Neo. It's for free. Anyone can download this, okay? And Chart Neo gives me the option to go in and look at your chart. You share that chart with myself or with the fertility advisor. And if you have issues, you then say, I can't understand my cycle. And what I do is I open up your app and I look at it and I will tell you, well, this is where you ovulated. This is what you need to look for onto your next cycle. Track your cycle, guys. It's important. And I know that maybe we have very young viewers. Education is key. If somebody's 19, 20 and they don't know how to track their cycles, they will come to the clinic when they're 36 and they won't know. So start young. It's an app. Everyone has a million apps on their phone. Do it. And if you don't know how to do it properly, ask for help. This is the idea. People don't talk about cycles and fertility. Ireland is still very taboo when it comes to this subject. Ask. We're there to help. The girls are amazing. I am on Instagram.
It really is. Education is so important, because when we even are educated from that young age about our menstrual cycle, we're just taught about this 28 day that you ovulate on day 14, and that really doesn't give the full picture.
As I said, when you know how to track your cycle, you can identify an early ovulation event, a late ovulation event, no ovulation event. You might have months when you're super stressed, your cortisol level is high, your sex hormones are low, you're not going to ovulate. Yes, you're going to have a cycle, but you're not going to release an egg. So, as I said, I think we should actually do a webinar on tracking your cycle with examples to be able to, understand better how to track your cycle properly.
Oh, not good, Codruta, because we'll be on your back now waiting for another webinar.
Yeah.
Honestly, if I can educate and help, I'm here for it. If the day would have 36 hours instead of 24.
I think that leads us into, we are tracking our cycle, we are looking at our cervical mucus, and as Dr. Codruta mentioned, we do have a more detailed webinar on that. But if we have all those things in place, we're really in tune with our cycle. What testing do you think that we should consider, maybe if we are kind of at the start of our fertility journey?
Very good question. So I know providers out there are throwing tests at people unnecessary. If you to ask me, it's the majority are unnecessary. So what you have there is it's very good. The hormone testing, it's very, very important at the beginning of your cycle. Day 3 blood test is called, okay? So day 3 can be done day 2, 3, 4, or 5 of the cycle. It will give us a very good insight of what's happening with your sex hormones, with your LH and FSH. Those two are important at the beginning of the cycle. Estrogen, progesterone, not so much at the beginning of the cycle, because they're not giving me clinical information as much as it will give me later in the cycle. Full blood panel, perfect. B12, folate, and iron, very important. Those 3 are always checked. The iron storage is important. If somebody had very heavy periods for 20 years before they come, they're trying to conceive, they might be anemic. We don't want somebody who's anemic. The body who's anemic, it's under pressure. We don't want any pressure when we're trying to conceive. Thyroid, super, super important. I can't speak enough about how much the thyroid does for the body, for the reproductive system. I urge every single doctor out there, when you do check a thyroid, do a full profile, check the thyroid antibodies, check T3, T4, and TSH. People come and they have lots done and they only have a TSH or a T4. And I'm like, we have to check your thyroid antibodies. We live in a world where autoimmune diseases are absolutely fulminating. What are the reasons? Multiple. But the endocrine disruptors are big in 2024. Everyone uses plastic. Oh, we cook in plastic. We put microwave plastic containers in the microwaves for 3-4 minutes. We don't do that because we're ingesting microparticle of plastics. They are the biggest endocrine disruptors nowadays. We use self-tan, and I know, sorry guys, and I know, but I have to say it because girls are sleeping in this self-tan, and everything is disrupting your endocrine system. When you're sleeping, you're supposed to recover. Your cells are recovering. You give them extra job. We're trying to get a tan overnight, and you don't want that. It's all toxic. It's not natural. Sorry. And to be honest, I know you guys are Irish, and you absolutely want to be tanned. But I am coming from Romania, where the majority are tanned during the summer. We're not tanned during the winter, minus 20 degrees. We love your skin. Your skin is beautiful. Irish skin is just, it's unbelievable. The tattoos are sitting really well on your skin. Don't cover it with self-tan.
I think it would be hard now to get us Irish girls to
I'm not telling you not to, but I'm telling you to be aware that
of course
it can be a hidden factor when it comes to your health. You'll be like, what? Yeah, it can be. Pesticides, everything is sprayed. So thyroid, very important. Check it on day 3. Vitamin D level, 100%. B12 and D, very important. Check a D2 and D3 level on your day 3 blood test. What else we're checking extra that you don't have there? A DHEA level. This is bigger and bigger and bigger. DHEA is a building block hormone for your sex hormones. Estrogen, progesterone, and testosterone, okay? So when you're running low on DHEA, you will be running low on ovulatory hormones. Bad. Recurrent miscarriages, very hard to get pregnant. Poor egg quality, poor sperm quality. So DHEA, I am asking everyone, do a DHEA non-sulfate. The labs in the hospital will run a DHEA sulfate. Okay, I can accept it, but if you have the option to ask for one, check your DHEA non-sulfate. Together with DHEA, you want to check your testosterone level as a woman, because if you're low in both, that means that you need support for your hormones in trying to conceive. It's easy to be fixed. It's easy to be identified. Big DHEA. They're the main ones that you would like as a baseline. And then obviously if you come to us and you have a bit of an issue, then we can add extra ones, autoimmune, blood testing, but this is what we need to start with.
Yeah, I agree. I think this is if you have this information, it gives you a lot of insight into where your hormones are at, where your nutrient stores going into your fertility journey and pregnancy are, and then the thyroid, because it plays such an important role in those first few weeks and months of pregnancy, that we want to ensure that is in a really optimal place. So I think that's really helpful. So let's kind of talk about AMH, and I suppose this is something that probably divides a lot of people. But what would your take on AMH? When should we look at it? When does it really play an important role in our fertility?
So AMH is one of my favorite subjects. After I joined the clinic and I did my training, I started hearing about AMH, and I was like, Jesus Christ, a few years ago, nobody was checking no AMH. People were just ovulating and that's it. So what is AMH? Anti-Mullerian hormone is basically an indicator of your egg reserve, okay? So everyone needs to know that we are born with a certain number of eggs. We are born with them. They're dormant, tiny little follicles, okay? Every month, your ovary, super smart organ, will recruit one of those little follicles, and during the month, it will grow it to a big follicle, which will then collapse and release your egg to be fertilized. AMH is an indicator, guys. It's not an indicator of infertility. Please, this was made big out there by the IVF clinics, because they want to see a certain level of AMH in order for them to be able to say we have to stimulate and we want to take out 12 eggs or 14 eggs to be able to give you 2 embryos. And don't panic when it comes to AMH. Low AMH, we treated with success with restorative fertility medicine. We have many successful stories. I'm going to start posting them because people need to see that after they were advised to go for donor eggs, and some of them went for donor eggs, and it failed. They came to the clinic and they have their own kids with their own eggs with an AMH of 0.7 or 0.9 or 1.2. So it's making me somehow frustrated and sad for those people who went through those journeys and they were scared into low AMH. You can't have babies. No. What we will do with restorative, we'll say, why is it low? Is it something autoimmune? Usually it is. And then we're going to give you a special treatment and we're going to maintain your AMH, even if it's in your boots. We'll get you pregnant, we'll get you a baby, we'll maintain it. You guys are nutritionists, so you know much more about how nutrition has an impact on your immune system. What we're eating can help or can destroy things in our body. So with the proper care and the proper advice, AMH can be maintained. When you get pregnant for 9 months, you do not use your egg reserve, or when you're breastfeeding. So you will see that if you're checking your AMH today and you're checking it in a year, it might be higher because you were pregnant, might be slightly bit lower, but that is absolutely normal. It varies with months, with pregnancy, with breastfeeding. No more panicking about low AMH.
I think that will be a massive relief to a lot of women, because I do think that, and even I've had a personal experience where when I wasn't kind of in tune or hadn't the information where I'd gotten that kind of low AMH, and it does, like, it can be quite daunting to get that. So I think just knowing that protecting your egg quality and that's what we're going to discuss now, what is actually within our control when it comes to preserving our egg quality and also supporting it. So what factors really do affect the quality of our eggs?
So when we look at lifestyle factors, they're huge when it comes to the egg quality. Smoking, and when I say smoking, any type of smoking, okay? So where we're trying to conceive, we have to think it like this. Smoking is going to damage the quality of your eggs. Smoking is going to damage the quality of your sperm. Alcohol. So I am a very, very, let's say, unusual doctor who won't tell you stop drinking. But I will tell you, if you have one as a treat, or you go out with your husband and you have a date, that's fine, as long as it's not a regular habit. If it's an occasion, enjoy it, own it, feel it, but don't drink on a regular basis, because that will have an impact on your egg, obviously on the sperm too. What we're eating, insulin resistance. 80% of the population is insulin resistant because they're eating what they're not supposed to eat. They're overworking their pancreas. If you're insulin resistant, your egg quality is going to be poor. Okay. Age. Yes. Age definitely has an impact. We cannot stop aging. That's a fact. Okay. But what we can do is improve how we age. Because if we age healthy, then the eggs will be healthy. If we age unhealthy, then the eggs are going to be unhealthy, okay? Obviously, whatever nutrients or even like the vitamins that we take, we have to supplement certain things. We cannot take them from food. Even if you eat loads of beans, your iron storage can be low. You might not absorb as much as you eat because you have issues. Oh, but doctor, I don't have any problems. But I do have acid. Well, you have acid. That means that the absorption of what you're eating is not happening. So definitely what we're eating. Sleep. Yeah. How we're sleeping. All doctors never ask, how do you sleep? Well, I do. They look at me, they're like, what? I'm like, sorry. Yes, how you sleep, how much you sleep. And if you sleep a lot, but it's not a good restful sleep, that has an impact on your eggs. Stress, come on. We won't even talk about stress because when my patients are coming in, the first thing I say is, now we're gonna start delegating and we're gonna be in nesting mode. Honestly, when you're trying to conceive, you want your body not to be involved in any extra stress, even if it's a good positive stress like intense working out in the gym. That's gonna tell your body that's already engaged into something. It's not gonna give the body a big task like making a baby. Okay, so take a step back in order to move forward. And this is the main things that they are definitely impacting on your egg quality. The impact of poor egg quality on fertility and pregnancy, big. If you have a poor egg to start with, the sperm is not going to go to fertilize that egg because sperm is very selective from my experience. I see a lot of things happening in the clinic. So yeah, they're very selective. You want a big, strong, shiny egg right in their face. And if it's poor, it's not going to be shiny. And yes, and if you do get pregnant, you get to fertilization, you have high chances of miscarrying because that embryo is not right from the beginning. And if it's not right from the beginning, that means that the body will say, let's choose. Should we have a child who has special needs or who won't survive outside the uterus, or should be abort mission? Super smart body, abort mission, miscarriage.
Okay. So I suppose a lot of what I'm taking from what you're speaking here is that our lifestyle and our diet is really like kind of in the driving force, which is really positive in a sense that we actually have so much control over it. We can decide to make better food choices. We can decide to put in place some stress management techniques, not over exercise, which I think for a lot of people can be something really positive to say, okay, not everything when it comes to my fertility is out of my control. I actually have, there's so many things that I can put in place.
They're in the driver's seat.
Yeah.
So when they come to me, I give them authority. I lead in the background, but they have authority. They will make the changes. They will make the good changes. And if they do, I see pregnancies coming in. And if they don't, I then go, what did you do? Why? You are in control. And I know sometimes it's so hard for you as a person to take big steps and you know, dive yourself into big actions. Small steps are winning the race.
100%.
So we're in control of our egg quality. We are going to preserve our fertility from the young age. When you know your cycle, you're not going to go and get yourself on the pill because you're going to just dysregulate everything. You're going to know when to be acting like, well, hey, if you have intercourse, obviously, when to do it, when not to do it, if you don't want to conceive. And by not impacting negatively on your cycle, on your ovulation, you're going to preserve your fertility.
Amazing. So let's talk then a bit about male fertility, because I think so much of the onus when we're kind of on that fertility journey, as a couple, it can really land on the woman. And I think we can say, okay, we're the ones that have to make all the changes, take all of the supplements, without realizing that our male counterparts are 50% of the picture.
You're very right. So the reason for at the clinic, I'm here, and then I have two chairs in front of me. Two, not one. It's two for a reason. It takes two to tango. Well, kind of three because I'll be in the background, but so it takes two to tango. Never ever assume that your husband goes to the gym, looks good, eats healthy, he has a good semen. never ever come into this equation thinking I'm the one who it's guilty for this. This is not working because of me. Like you said, 50% of the picture. Yes, male fertility is declining over the last year. I see it in the clinic. It's worrying me. Whereas before a year and a half ago, maybe we had 1 in 4 or 5 couples where we had a huge male factor. Now we have 1 in 2.
Okay.
So again, why so many? Exactly what I've said: lifestyle factors, what they're eating, stress management. Everyone has a career nowadays. Where are the people with no careers, please? Like, they're healthy because they're not as stressed and they sleep, you know. But when you're striving for perfection and you want to be the best at your job and the best manager and the best company, and you're offered I don't know, big money for whatever target you're reaching. Sorry, but that's not going to help your fertility or your semen. So take a step back again, you know, just to improve things. Sperm analysis, good question. Sperm analysis versus DNA fragmentation. A complete semen analysis is what I want to see, because sometimes semen looks perfect under the microscope. Good motility, they move fast enough. Good number, concentration, perfect. No issues whatsoever. But then we don't get pregnant. And why, doctor? Because we might have a high DFI, which means high DNA fat. So when the sperm is not protected against DNA damage, the embryo that, if you get pregnant, it will take you longer to get pregnant with a high DFI, and you have higher chances to miscarry. Again, sperm or egg, not good quality, they meet, and the embryo is very poor quality, your body's going to get rid of it. It's the best. Like, if people are coming in and they're asking me, should I have a semen analysis? I go, well, depending on their clinical picture, yes, but please have a complete semen analysis.
Yeah.
Not just the basic one, because that's not telling me anything. Yes, it's telling me things, but if you do have a problem of conceiving, I want to see the DFI. Best ways to support sperm health. There's a few things that I actually ask all the guys who are now my patients, and I go, start with looking at yourself. Are you happy with your weight? Guys tend to put on a bit of weight after a few years of marriage. And then that's when the problem, oh, well, actually, we didn't want a child for the first 5 years, but now we want one, now we can get one. So look at your weight and say, am I happy and healthy with my weight? If there's a little doubt, you're not. That means that you need to lose a bit of weight. You need to be active. Every second day, put on a sweat for 30 minutes. But to sweat, to pour, any type of physical activity. Again, endocrine disruptors, big for them as well. Yeah. Every single thing, pesticides, working environments with fumes, mechanics, the likes of any chemical environment, it has a big impact. Phone in the pocket, no more phones in the pocket. It makes a huge difference when it comes to DFI. Guys, please don't use your pockets to put your phones. No, don't use your laptops on your lap. Please stay away from anything that might involve, electromagnetic field. It's damaging. Okay. Drink water. Stop drinking beers and alcohol every day. Drink water and then have a little bit of a drink whenever. Not every day because it's a match on. No, not every day. Stop smoking.
Yeah.
Big time. Check for insulin resistance. More and more guys I'm checking, and they are insulin resistant. So we go back to the supplements that you guys have in your supplement, the myoinositol. Big one in fertility for the guys. So in a nutshell, be active, sweat, be mindful of what you're eating. No phones in the pocket. And if you do have a big male factor, I'm here to support with treatment. medications. I send them to the urologist. I send them for ultrasounds. And then if actions need to be taken, I'll send them for that too.
Fantastic. I suppose what I think is, or what I love hearing, is that so many of the recommendations for both supporting male and female fertility, egg and sperm, they really overlap. So if you are in a couple who is trying to conceive, or you're starting your fertility journey, it doesn't have to be that you're on two separate paths. There's two separate recommendations. A lot of it is going to overlap, and
it's teamwork.
It is.
And then when only one is involved, usually it doesn't really work, and one is not involved. But when both of them are involved, we will have bad days. And when one is down, the other one is going to pull the other one up, and vice versa. Teamwork makes the dream work.
So we'll quickly just talk about, I suppose, getting your hormones in balance ahead of trying to conceive. And often we will, in my practice, women will come and they'll want to, they're either a couple of months into trying, or maybe they're just trying to like get themselves ready, but they're experiencing a lot of PMS symptoms, maybe spotting before their period, really short luteal phases. And I suppose working on that is so important before we even get to the let's try to conceive. So what things do you think we should really focus on?
So again, everything kind of brings us back to knowing your cycle and tracking your cycle, because even before thinking that you want to have a baby when you're 41 or 39, you want to make sure that the cycle is healthy. Because if the cycle is healthy, you shouldn't have very bad PMS. You shouldn't have intermenstrual spotting. You shouldn't have a short luteal phase. So that means that your progesterone is in your boots. And that means that you have to do something to help your progesterone in the luteal phase, to lengthen the luteal phase, to feel better, not to have spotting, not to, have the bad PMS, to leave with them. And sometimes when they're so bad and you are taking action and it's not good, it's not working, you want to make sure you're checking out other possible causes. Don't forget about endometriosis. It's huge at the moment. Don't forget about polyps, uterine polyps, huge. And people say, oh, but I'm spotting every little bit. And it's not normal. It's not normal. Look for advice. Go to see a doctor who specializes in women's health. Ask questions. How do we balance our hormones? Exactly what I said, a good, healthy cycle. How do we do that? Your product is amazing. Now, I haven't tried it yet.
We'll have to make sure you get some.
Exactly, a little courier. I'm going to try it, and I'm going to give you my honest opinion. Everything that I've heard so far from different people, it's all good feedback. Your blend has a lot of everything that I love personally: magnesium, zinc, selenium.
I'm going to skip ahead so we can actually just have a look at
what's in. There you go. So majority of my patients, I'll put on magnesium. There are studies done how great of an impact magnesium has on PMS, on hormonal health. Inositol, love it. I told you. It's one big thing that we use in our treatments. Vitamin B2, perfect. Folate, you always go away from my clinic on folate, and you have everything in there. Calcium, there you go. Not everyone eats and drinks their milks. I don't like anything that's white, so well, except ice cream. Selenium, thyroid health, absolutely love selenium, especially if we have thyroid antibodies. And nowadays, as I said, autoimmune diseases are fulminating. Zinc, perfect, regulating ovulation and combat hormonal acne. Acne is big nowadays. Is it because of hormones? Probably. Is it a combination? They don't eat right. They don't sleep right. They don't. Zinc is really, really good one. B6, there you go. Serotonin production. We all love our endorphins, and that's helping with endorphins. I grew up knowing that magnesium, always you have to take it with vitamin B. in order for that to absorb better, you take them together, magnesium and B, and you have it in there, and you still have a few more.
Yeah. I suppose when we were creating this blend, we absolutely kept in mind women who would be taking it while trying to conceive, and being a really supportive and comprehensive blend, as well as someone who might be trying to conceive but also has PCOS, and knowing the importance of inositol for supporting ovarian function and blood sugar balancing, as well as the zinc and the magnesium. So yeah, it really was at the forefront of our mind, and we've had such incredible feedback, and so excited for you to try it.
I cannot wait. And like, honestly, if I think adherence it's a huge factor when you're trying to take so many supplements. Okay, so people are good for a month or 2 or 3 or 4 or 5, but then they come from 5 years of fertility journey to me, and oh my God, the pill boxes, and I go, oh wow, okay, yes, it would be in an ideal world, I'll have one supplement for this, one for that has loads. You take this, put it in your shake, put it in your smoothie, take it, and like that, you're gonna have less PMS, better hormone support during the month. So I think this is how we will try to balance your hormones before. This is how you do it. Balance your cycle, then you're balancing your hormones.
Fantastic. And I think we've kind of covered the nutrition and lifestyle, and really how that impacts our fertility. And as I mentioned before, we do have a full webinar called Female Focused Nutrition, which goes into this in a lot more detail. And we will share that tomorrow when we're sending on the recording. And then we've talked about the lifestyle influence as well. So I don't think we need to spend too much time there.
Just a quick one, because on that slide, on that slide, that girl has a lovely eye cover mask. How do you call this? So a recent conference last week, Restorative Reproductive Conference, not sure, the Spanish one, I think. Now studies have shown that if you sleep in a very dark room, for ovulation event, and your follicle will rupture better.
Wow.
So let's sleep in the dark. Let's forget about little lamps and whatever little lights, and I'm afraid of the dark. If you want to have a good ovulation event, go for the dark. Have a little, if you know, sometimes we have good blinds, but we still have a little bit of light coming in, and Jesus Christ, 4 o'clock in the morning, I can definitely read without the light on, because it's so bright. Put this little mask on. I have a few for flights, and I never use them because I think people will look at me and say, Jesus Christ. But there you go. Helps.
That's a great tip.
Fertility, and it's for free. Like, just a dark room, you know.
That's a really good tip, and I think we could all treat ourselves to a nice silk one just to support our skin as well.
Correct.
So thank you so much. I think we're going to stop the recording now, and we're going to go through some of the questions. So Jenny, you might bring up some of the ones that we had got.